Doctor's Worklist. Before accessing the doctor's worklist, please ensure that you have the correct patient list pulled through in the patient list screen, and then come through to doctor's worklist. You will initially see a red banner. Remove that for a moment and ensure that you are in the correct patient list. After which, initially, you'll probably want to configure the columns so that you can view what it is that you wish to view. Unfortunately, there are too many columns to be accommodated on this screen. So click on Configure Columns, and you will see that there are viewable columns, non-viewable ones, and disabled ones. So for instance, you may not want to see the resus column, so just pull it down, it's interactive. But you may want to look at the labs. You can also move these headings up and down where you want to view them, and then apply. And you can now view the information. If you have another patient to assign to yourself, you would come here, remove the red banner, and go to Establish Relationships. In other words, assign yourselves to this patient or vice versa. Robert Ives, for instance, is your new patient. You would tick that box and establish. And now you can view Robert Ives with all the relevant information, the lab results, the visit details, and here we have the various tasks that need to be carried out. For instance, VTE risk assessment. In this case, it's a reassessment. Here, instead, we have a VTE on admission. So you'd want to click on that. You can access it from this point. Click on there, VTE risk assessment, and then tick the appropriate information. Go back to the previous screen. You can override it in a medical emergency. Otherwise, you have to fill in the mobility details, and depending on what you click on there, it may bring up further yellow fields. Remember that yellow fields are mandatory. Go to the top left-hand corner and sign the form. In all forms, you will have 3 icons in the top left-hand corner. The tick, which is for sign, the floppy disk, which is for save, and then cancel, the circle with the bar through it. If you hover over any of these icons, it will tell you what they are for. Establish relationships, tick the patient you want, and then establish. To the right of the name and demographic details is an arrow pointing to the right. This will take you to the IPASS. The IPASS, or IPASS, is an acronym for I for illness severity, P for patient summary, A for actions, and S for situational awareness and planning. The function of IPASS is to help an incoming doctor, a doctor coming on duty, to be able to see at a glance what the situation is regarding a particular patient. So, for instance, the outgoing doctor would record that the patient condition is unstable, would type in a summary, and then save that summary. And of course, more can be added if necessary. And then You can save it again. Any actions that the outgoing doctor requests or recommends or suggests, once again, save, and the incoming doctor would look at that list and then tick it off when it's been carried out. Remember that any clinician can actually tick that box. And now it's under show completed. There it is. Situational awareness and planning, once again, free text information in there for the incoming doctor. So the incoming doctor will take a look at all of this information, go on to the clinical data, view the vital signs, the laboratory results, the medications that have been prescribed or administered or discontinued, and the fluid balance. Please note that this information in the iPass screen, with the exception of the illness severity, this information will not appear in the patient's record. It is specifically there for the incoming doctor to check on iPass. The doctor will then be able to access the patient's record and would do so by clicking on the patient's name here highlighted in blue.